Ever wondered how surgeons perform a craniectomy? Let's break it down step by step. Incision. The journey begins with a curved cut in the scalp, exposing the skull. Burr holes. Next, small holes are drilled into the skull. Think of them as access points to the brain. Bone flap removal. The bone flap is carefully cut and removed, revealing the dura mater, the brain's protective layer. Dura opening. The dura is incised, allowing surgeons to relieve pressure and remove clots or damaged tissue. Closure. Finally, the dura is closed and the scalp is sutured. The bone flap is stored for future reattachment in a follow-up procedure called cranioplasty. Craniectomy is more than just a surgery. It's a second chance at life. If you found this video fascinating, don't forget to like, share, and subscribe for more 3D surgical tutorials. Thanks for watching, and we'll see you in the next video.